Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 203 of the Ask Dr. Angela podcast. So I'm sitting here in my office/studio drinking my grande soy caramel macchiato, and what instantly popped into my mind was, got milk? And I don't even know why I just thought of that, but it might have something to do with the fact that I recently saw a patient for a postpartum visit, and she was doing amazing. The reason that I'm mentioning that she was doing amazing is because when I had previously seen her, she wasn't doing so amazing. She was suffering from some postpartum depression, and it stemmed from the fact that she felt as if she was less of a woman because she didn't breastfeed. And she felt that not only other physicians, but her friends and even the staff at the hospital were just kind of browbeating her because she chose not to breastfeed. And I thought, really? And so, one of the things that I shared with her was, first of all, I'm your OBGYN, and I'm going to let you in on a little secret. Newsflash, I didn't breastfeed. And whether or not women choose to breastfeed is a really personal choice. And I do know that some offices and practices and hospitals can be very aggressive in their promotion or encouragement of breastfeeding. And yes, we all realize that there are lots of benefits for, moms to breastfeed, healthier babies and being able to pass on, antibodies from mother to baby, decreased risk of SIDS, moms will burn more calories breastfeeding, it will help your uterus shrink down faster, it's free, the list goes on and on and on. However, having said all of those things, I do think that breastfeeding is a personal choice and it's a woman's choice, and that women should not be made to feel bad or less than because they choose not to breastfeed. We are all our sister's keepers, and I just think that, we should just be mindful that people have a right to choose, and what's right for some may not be right for others. And certainly when I saw this patient, one of the reasons that I was so happy to see her and so happy to see that she had come out of this is that, when you reach a point in your life that you're comfortable with your own decisions and are able to say, this is my choice, this is what I choose, I'm just going to go with it and move on, that's empowering. Because it's not just about breastfeeding. That translates into every other aspect of your life and your journey in life. Being comfortable enough with self and being confident enough in knowing what's best for you. Because no one else knows what is best for you other than you. So I guess in closing, what I'd like to say is, yes, I'm a huge promoter of breastfeeding and all of the benefits that are associated with it. However, if I have a patient or know a mom or a woman who chooses not to do it, then that is certainly her choice and it should be respected. So, breastfeeding doesn't make you a better mom, it doesn't make you a better woman. It just means that you made a different choice. Choosing not to breastfeed doesn't make you any less of a mom or any less of a woman. Again, it just means that you made a different choice. So in closing, I'd like to just leave you with this. Breastfeeding is amazing. The benefits associated with it are amazing, but it isn't for everyone. Thank you so much for tuning into today's episode of the Ask Dr. Angela podcast. If you have a topic or question that you would like featured, you know what to do. Hit us up at www.askdrangela.com. That's AskDrangela.com. You can either directly email me, you can direct message me on any of our social media venues. Please check out our podcast, our YouTube channel, as well as our weekly blog post. They're funny as hell. So until next time, I'm going to leave you with this. Yesterday is not ours to recover, but tomorrow is ours to win or lose. That's from Lyndon B. Johnson. Thank you so much for tuning in. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 204 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.